So today we are discussing about joints. We know that joints, it is a connection between two or more bones, and it allows the movement. It allows the movement of bones, and some joints are also immovable. And also, for example, when we take the joints present in the vault of the skull, they are immovable joints. Okay, so joints, they are nothing but they are the connection between the two or more bones, and they allow the movement of the bones. And coming to the joint structural classification of the joint, we have fibrous joints are present. So fibrous joints include sutures, syndesmosis and gymphosis. Sutures, they are mainly seen in the sutural bones, they are mainly present in the vault of the skull. Here we can see the sutural bones are present. The sutures may be denticulate, the sutures may be serrate sutures here, and the sutures may be squamous. They are mainly seen in the vault of the skull. Okay, and coming to the syndesmosis, syndesmosis is seen, that is nothing but these joints are united. The two bones get united by an interosseous ligament. The two bones get united by an interosseous ligament. That is an example of syndesmosis. Example is the inferior tibiofibular joint. Inferior tibiofibular joint. Okay, and coming to the gymphosis, gymphosis means nothing but the presence of tooth in the sockets. Presence of tooth in the sockets is nothing but the gymphosis. So coming to the classification of joints, one is fibrous joints, and the next one is cartilaginous joints, and third one is synovial joints. Coming to the fibrous joints, we have two sutures are present, which are seen in the vault of the skull, and squamous sutures and serrate sutures, denticulate sutures are present and come in the vault of the skull. And coming to the syndesmosis, syndesmosis is nothing but the two bones get united by an interosseous ligament. The two bones get joined by the interosseous ligament. Example is the inferior tibiofibular joint. They are present in the leg, and these two bones, they are present in the leg and present in the gymphosis. Gymphosis is immobile and present nothing but the presence of tooth in the socket. Okay, and coming to the cartilaginous joints. Cartilaginous joints are primary and secondary cartilaginous joints. These primary cartilaginous joints, the two two bones, they are united by a plate of hyaline cartilage. Usually in future, what happens here is this hyaline cartilage, it is deposited by the bone cells. So primary cartilaginous joints are nothing but they are temporary joints. Okay, primary cartilaginous joints are temporary joints. We can see the joint between the epiphysis and diaphysis. In between the epiphysis and diaphysis, we have a epiphyseal plate of cartilage is present. Okay, and during the development of bone, we have discussed this. So this the primary cartilage, the two bones, they get united by a plate of hyaline cartilage. And coming to the secondary cartilage, examples is the costochondral joint is also examples of the primary cartilaginous joints, and also joint between the epiphysis and diaphysis of the bone. Okay, and coming to the secondary cartilaginous joint, they are covered by a plate of hyaline cartilage, and the articular disc get united by fibrous cartilage. The articular disc get united by the fibrous cartilage. Here is the fibrous cartilage, and their joint is covered by hyaline cartilage. Secondary cartilaginous joints usually occupies the midline structures of the body: manubriosternal joint, pubic symphysis menti, and pubic symphysis. That means the two hip bones that united, they are forming a secondary cartilaginous joints. That is nothing but the pubic symphysis. Okay, and coming to the synovial joints, plain synovial joints we can see in the articular surfaces of the vertebra. So the vertebra, articular faces, they are united by the plain synovial joint. And coming to the hinge joint means it allows the movement. Here it is in the form of the articular surface is like a pulley shape. Example, the elbow joint, which is formed by the humerus, lower end of the humerus, and the trochlear notch of ulna. This is ulna and this is humerus. So it allows movement only in one axis, that is in the transverse axis. So hinge joint is nothing but the articular surfaces are like pulley shaped. Okay, and coming to the pivot joint, this is the pivot joint. The articular surface is surrounded by an bony osseous ligament. Here we can see the radio-ulnar joint is present here. This is the head of the radius, and this is the ulna, and here they are united by one ligament, that is called annular ligament. So here the articular surfaces, they are united, they are surrounded by an osseous ligament. That is nothing but annular ligament here. Example is the superior radio-ulnar joint. Okay. And coming to the saddle type of joint, we can see here in the first metacarpophalangeal joint, first carpometacarpal joint. This is a saddle type of joint. Here the nothing but the articular surfaces looks like the saddle. Okay, and coming to the other type of joints are the condylar joints. Here the condyle surfaces, the convex condylar surfaces are nothing but the male surfaces, they get articulated with the concave female surfaces. Nothing but the condylar joints. Example is the knee joint. It allows movement only in one axis, that is along the transverse axis. So the male convex surfaces, they get articulated with the female concave surfaces. Okay, that's about the condylar joint. And then but the saddle joint. And the other type of joints we can see here are the ball and socket type of joints. Shoulder joint is the best example of the ball and socket joint. The ball is formed by the head of the humerus and the socket is formed by the glenoid labrum of the scapula. And here ball and socket type of joint is present here. That is the best example is the shoulder joint, and the joint cavity, it is surrounded by the acetabular labrum. So ball and socket type of joint is also one example of ball and socket type of joint. Okay, is also one example of synovial joint. Okay, so these are the various types of synovial joints. And first here we can see another type of joints are the ellipsoid joints. Here the lower part of the ulna and radius, they get articulated with the carpal bones. Here we have carpal bones are pisiform is present here, pisiform scaphoid they are present here, the carpal bones are present here. They get articulated with the female convex surfaces, they get articulated with the male concave surfaces. Okay, so that's about the ellipsoid joints. So different types of joints are seen, we can see here. One is fibrous joints, cartilaginous joints and synovial joints. They allow the easy movement of the joint because synovial joints, they are surrounded by a capsule, and inside the capsule we have synovial fluid is membrane, which is surrounded by synovial membrane. Synovial fluid which lubricates the joint. In old age people, because of the absence of the synovial fluid, what happens here is the movements becomes rigid. Okay, we can see in the arthritis conditions. And here the nerve supply of the nerve supply, it is more around the capsule and also around the joint. The nerve supply is more and the capsule is sensitive to pain. And coming to the synovial membrane, and synovial membrane, it is insensitive to pain, it is not supplied by nerves, and the each nerve supply is seen around the capsule and articular disc. Okay. And coming to the blood supply is by the epiphyseal arteries, which is present surrounding the bone, supply the joints. Okay, so that's about the joints, fibrous, cartilaginous, synovial joints. So in the fibrous joints we will discuss about sutures, squamous, sutures and syndesmosis and gamphosis. Sutures, syndesmosis and gamphosis. Gamphosis example of tooth present in the socket. And cartilaginous joints are the primary and secondary cartilaginous joints. Primary cartilaginous joints are temporary, they will further ossify by bone. Secondary cartilaginous joints are present in the midline. And coming to the synovial joints, we have place synovial joint, hinge joints. Example is the radio elbow joint, and pivot joint is nothing but the radio ulnar joint. And we have ellipsoid joint, nothing but ellipsoid joints are nothing but the wrist joints. They allow all the movements. And coming to the saddle type of joints is nothing but first carpometacarpal joints. And ball and socket type of joint, it also allows all the movement like flexion, extension, adduction, abduction and circumduction. Ball and socket type of joint also allows more number of movements. Condylar joint, it also allows only one movement along the transverse axis. Here the condyles, male surfaces are convex and the female surfaces are concave, and they get fit into the forming a joint. Okay, and here are the different types of joints. These are the different types of fibrous joints and cartilaginous joints as well as the synovial joints. General anatomy అయిపోయింది. General anatomy joints అయిపోయింది. ఇప్పుడు so today we are discussing about general anatomy of muscles. So muscle is a contractile tissue which brings about movements. We know that muscles are contractile tissues which brings about movements. Muscle is a contractile tissue which brings about movements, and muscles are considered as the motors of the body. Muscles are considered as motors of the body. Muscles are considered as the motors of the body, and we have three types of muscles are present. One is skeletal muscle, and the next one is smooth muscle, and the third one is cardiac muscle, which is confined to the heart. The name itself indicates the cardiac muscle is confined to the heart, and here is the skeletal muscle. The skeletal muscle is attached to the skeleton. That is attached to the bones. Okay, the skeletal muscle is attached to the bone. That's why the name skeletal muscle. Skeletal muscle, otherwise called as striated muscle, striped muscle, voluntary muscle. More number of other synonyms are there because the skeletal muscles, they are supplied by the motor nerves. That's why they are under our control. That's why they are voluntary muscles. Skeletal muscles are also called as voluntary muscles. All the muscles, they are attached to the skeleton are the skeletal muscles. Examples are the biceps, triceps, and also we have more number of muscles. Temporalis muscle is the skeletal muscle, and the thyroid muscle, and the sternothyroid. We have trapezoid muscle is there, trapezius muscle is there, sternocleidomastoid muscle is there. All muscles are the skeletal muscles, and they are supplied by the motor nerves, and also they are respond easily to stimuli, and they cause rapid contractions, and they fatigue easily because they respond quickly to the outside stimuli, so that they undergo rapid contraction, and they will fatigue easily. And in the skeletal muscle, you will able to see more number of striations are present, cross striations are present in the skeletal muscle, and the nucleus is the multinucleated condition is seen in the skeletal muscle. Multinucleated condition is seen, and the cross striations are seen in the skeletal muscle. These cross striations are because of the because of myofibrils are responsible for the striations, and these myofibrils, they are formed of three filaments: actin, myosin, and tropomyosin. And these they are nothing but the contractile elements. So the transverse striations of the skeletal muscle, which is nothing but the myofibrils. These myofibrils are made up of myofilaments. They are nothing but the actin, myosin, and tropomyosin. In actin and myosin, we have already discussed about skeletal muscle, detail about I band, Z band, H band, everything. We have sarcomere, what is sarcomere, everything we discussed during histology of muscles. So we will just outline is the skeletal muscles. They are under our control because these muscles, they are attached to the skeleton, and they are supplied by the motor nerves. They are capable of rapid contractions when outside stimuli takes place. So what happens here is they fatigue easily. Okay, and coming to the smooth muscle, smooth muscle cells are spindle shaped cells with tapering ends, and the nucleus, it is oval and is situated in the center, and the smooth muscle surrounds the viscera and also surrounds the blood vessels, and the smooth muscle fibers, they are supplied. This smooth muscle, it is supplied by the autonomic nerves. This smooth muscle, it is supplied by the autonomic nerves here. And one more thing is these are because of the produced by the innervated by the autonomic nerves. They are not under our control. That's why we call it as involuntary muscles. We don't see in the smooth muscle, we don't see any cross striations are present in the smooth muscle. And here what happens here is that because of it is supplied by the autonomic nerve, the people are undergoing rhythmical contraction, and the rhythmical contraction slowly and rhythmically, so they do not fatigue easily. And smooth muscle fiber does not show any striation. That's why it is called unstriped muscle. As it is supplied by the autonomic nerves, it is a involuntary muscle also. And also the smooth muscle, here it surrounds the viscera and the blood vessels also. Okay, so that's about the smooth muscle. And coming to the cardiac muscle, it is seen is nothing but a myocardium. It is seen in the myocardium of the heart. Okay, it is an intermediate between the smooth muscle and smooth muscle and skeletal muscle, because this cardiac muscle shows striations, transverse striations are seen, and here it is not, it is, but it is involuntary in action, because it is not under our control, that is it is an involuntary muscle. And here we can see in the cardiac muscle, we can see the branching pattern. The muscle fibers, they get the muscle fibers, they branch and anastomose with each other, they branch and anastomose with each other. And in the cardiac muscle we will able to see some intercalated discs are present. In the cardiac muscle we will able to see the intercalated discs are present. Nothing but the intercalated discs are nothing but the opposite cell membranes. Okay, so the cardiac muscle is an intermediate between the skeletal muscle as well as the smooth muscle. Okay, we have already discussed about what is sarcomere, what is the motor unit of the cell, we have already discussed. And the skeletal, and these muscles, skeletal muscle, it is supplied by the motor nerve, which causes mostly 60% of the motor nerves, and 40% is sensory, 60% is motor, and 40% is sensory. And here one more thing is, here some muscle fibers, they are quadrilaterally, they are how they are arranged is, some muscle fibers, they are arranged quadrilaterally, skeletal muscle fibers. An example is the thyroid membrane, and some muscle fibers, they are arranged strap-like. Example is the sartorius and muscle strap-like, and some muscle fibers, they are ribbon-like. Example is the stenoid and stenothyroid. And some muscle fibers, they are tendinous in nature, and example is the rectus femoris. And so there are multipinnate, unipinnate muscle fibers are present, and according to the place also some muscles are named. For example, when we take the temporalis, it is present in the temporal region, that's why it is called temporalis. When we take, because by the presence of bony points, everything, the muscles are named like that. For example, when we take the stenothyroid, it is attached from the sternum, it is attached to the oblique line of thyroid cartilage, that's why it is called stenothyroid. When we take stenoid, from the sternum it is attached to the hyoid bone, that's why it is called stenoid. By the name, by the presence of muscles, because of the presence of the bony points nearby there, the muscles are named. And here the muscles, they are richly supplied by the motor nerve. Skeletal muscles, they are richly supplied by the motor, and 60% are the motor and 20-40% are the sensory fibers. And that's about the muscles. So and also the muscles has a rich nerve supply also is present here, which is derived from the corresponding muscles. And the rich nerve supply and the nerves and the arteries, corresponding arteries, they are enter into the muscle at the neurovascular hilum. And one more important thing, entire muscle, it is surrounded by an connective tissue that is called epimysium. From the epimysium, the septa, they descend down into the muscle, and they surround the connective tissue surrounds a group of muscle fibers. We call it as perimysium, and each muscle fiber is surrounded by a connective tissue. We call it as endomysium. So each one muscle fiber which is connected by a which is surrounded by a connective tissue, we call it as epimysium. And bundles of muscle fibers, they are fasciculae, they are surrounded by connective tissue, we call it as perimysium. And each muscle fiber is surrounded by a connective tissue, we call it as endomysium. And here what happens here is, the arteries, they form plexus in the perimysium and plexus in the perimysium, and the very rich nerves, rich supply is seen in the, rich arterial supply is seen in the muscles. Okay, and one more thing is, and some muscle fibers, they are here like quadrilateral, some muscle fibers are fusiform, and they are nothing but the biceps muscle, and some muscle fibers are tendinous in nature, that is nothing but the rectus femoris. Some muscle fibers are strap like, nothing but the sartorius. Okay, the muscle fibers are ribbon like, nothing but the stenoid and stenothyroid. So that's about the muscles. So muscles are combined important: skeletal, smooth and cardiac. Skeletal muscles, they are under our control because they are supplied by the motor nerves. Smooth muscles, they are not surround the viscera and surround the blood vessels. Skeletal muscles, they are attached to the skeleton. For example, bones of the muscles of the limb. And cardiac muscle is confined to the heart. That's why it is called cardiac muscle. Okay, so that's about the muscles.